Alright, let's talk about arteries of the spine, the lower extremities, and let's start off by drawing the aorta. Now, one of the major branches of the aorta is going to include the inferior mesenteric artery. So the green artery that I just drew represents the inferior mesenteric artery, and this artery is important because it is going to supply the hindgut. Okay, and the hindgut is going to include the distal transverse colon. It is going to include the descending colon. It is also going to contain the superior 2/3 of the rectum. Okay, now supplying the superior 2/3 of the rectum is the continuation of the inferior mesenteric artery, which is the superior rectal artery. Okay, so the superior rectal artery is going to supply the superior 2/3 of the rectum, which is a continuation of the inferior mesenteric artery. Now, the lower 1/3 of the rectum is supplied by the middle and lower rectal artery. Okay, now that we've discussed this, let's discuss the iliac arteries. So we said that this was the aorta, and the aorta is going to split into two branches. This is the right iliac artery. This is the left iliac artery. Let's focus on the right iliac artery. It doesn't really matter because they're going to be same on both sides. Now, the right iliac artery is going to, so these are the common iliacs, okay? So the right common and the left common iliac. Let's include the common part. So the right common iliac artery is going to split into right external iliac and the right internal iliac artery. The internal iliac artery is important because it is going to contain vessels that are going to supply the pelvic region. So it includes the uterine artery as well as the vaginal artery. The uterine artery is important clinically because it is going to be the artery that is most often ligated by surgeons following bleeding by a female that has just given birth. Okay, so following birth, sometimes patients can bleed, and the surgeon is going to ligate the uterine artery in order to stop that bleeding. It is very important to know and high yield on the USMLE Step 1 exam that uterine artery is a branch of the internal iliac artery. Now, the external iliac artery, it is important to know that where the artery is in relation to the inguinal ligament. So let's say that what I'm drawing right now represents the inguinal ligament. Okay, so this is the inguinal ligament. Let's say that this is the pubic symphysis. Now, once the external iliac artery is below the inguinal ligament, it becomes the femoral artery. Now, if you're a medical student, You might have heard of the femoral artery because when giving a physical exam, sometimes they teach medical students to feel the femoral pulse. And most often, students are uncomfortable when trying to pulsate the femoral pulse. They are uncomfortable because the femoral artery is below the inguinal ligament, and in order to feel the pulse, you have to palpate the groin region. So that is one way that you can remember that femoral artery is under the inguinal ligament, by the fact that in order to feel the femoral pulse, you have to be in the groin region, which is under the inguinal ligament. Now, right before crossing or being below the inguinal ligament, the external iliac artery is going to branch, and it is going to give off a branch to the inferior epigastric artery. Okay, the inferior epigastric artery is important because it supplies the interior abdominal wall below the umbilicus. Just under the inguinal ligament, the femoral artery is going to branch and is going to branch into the superior epigastric artery. The superior epigastric artery is going to supply the superficial interior abdominal wall below the umbilicus. These two are clinically important. These two arteries are clinically important because they are going to be the arteries that are most often injured during laparoscopies. In preparation for a laparoscopy, surgeon places trocars on the abdomen, and most often these vessels are injured during the placement of the trocars. The other artery that comes off or branches from the femoral artery that is important to know is the medial circumflex artery. The medial circumflex artery is important because it is going to supply the femoral head. During a hip injury, for example, a patient can injure the medial circumflex artery. If the patient injures the medial circumflex artery, there is going to be decrease in perfusion to the femoral head, and that can result in osteonecrosis of the femoral head.